If you think you need to study approximately 200-300 microorganisms in micro just so that you can barely pass, this video is for you, because no, you don't. Hi everyone, my name is Apurva. I'm currently a third year MBBS student at GMC Ratlam, and today I'll teach you how exactly do you study micro so that you don't spend so much time studying and so little time actually getting your answers right. In this video, I'll teach you how to approach the subject. How do you make actually good notes which you will have much easier time remembering and recalling? How do you study organism specific, and how do you do the lab diagnosis without having to rote memorize every single thing? And lastly, how to write answers that examiners love. Approach to the subject could be divided into two parts. First, we have the general micro, and then we have the systemic. Moving on to general. The bulk of the general is your bacteriology. Yes, there is general virusology, mycology, parasitology, but the bulk of this unit is your bacteriology, which is the most high yield. So you need to learn the morphology and the genome, the genetics, all of that of the bacteria, the cultures, the tests. This is very high yield. You can easily score very well in this. So for this, you may refer to any pre-made notes, or you may refer to the book. Apurva Sastry is the one I would say you should follow. Then we have the other things. For example, virology, mycology. Here it is basic stuff, because you will be covering all of this in your systemic anyway, right? So for the basic, all you need to do is you need to know the classification of the organism. Let's say you need to know the classification of virus into RNA, DNA, capsulated versus non-encapsulated, and then generic lab diagnosis, nothing too specific. However, when we move on to systemic, when you look at an organism, you need to know what is the type of this organism. Is it a bacteria? Is it something else? If it's a bacteria, how does it stain on gram staining? What is the life cycle of this organism? Does it have vectors? Does it have hosts? How does it infect the host? The pathogenesis once it is inside the body. Is it like creating ulcers? Is it infecting your bloodstream? Then we have the clinical features. Then the most important part, we have the lab diagnosis with treatment if it is mentioned in the book. Now lab diagnosis, again, there is a way to do this. So lab diagnosis is a whole process. So you start from specimen, you will tell which specimen to take, and this is specific for your important organisms. You need not learn this for every single one. So specimen, how do you collect it? How do you transport it? Then macro and microscopy, what will you see? If you want to do a culture, what will you see? How will you culture it? Where will you culture it? If there are any other biochemical tests like TSI or anything else, and automated tests. So this is a very generalized idea of how do you cover a single organism. I would highly suggest that you make organism specific notes, because you remember in your NCRT you used to study that we have classified all these organisms into kingdoms so that it's easiest to study them. It's the same logic here. Almost all the gram-negative bacteria will have similar lab diagnosis. Almost all the gram-positive bacteria will have similar diagnosis. Almost all bloodstream fungus will have similar diagnosis, right? Lab diagnosis. So you need to know this specific blank flowchart of what lab diagnosis for a specific organism looks like. Once you learn that, then you'll learn the specific tests for specific organism. Like for example, I've learned the generic classification of an organism. Let's say Vibrio cholerae, which is gram-negative bacteria, right? And others in the same family. So I will do the basic, the gram staining, the media, the transport media, the culture media, right? I've learned all of this. Now I will learn the specific tests, specific diagnostic tests for Vibrio cholerae specifically. So that next time when I'm answering, even if I don't remember a lot of this, I have some idea that, okay, this organism was in classification with cholera, so their lab diagnosis will look similar. So that you don't have to remember a new lab diagnosis every time you come across a new organism. Again, as I always tell my juniors, cluster recall is always better than individual recall. So these are my notes. I will zoom in and then I'll break down my notes. In case you want to take the screenshot, this is your chance. This is the one-page notes, and these are the only one-page notes I have for HAI, the different types. Then we have filariasis, which I have combined into 2 pages, right? So, moving on to the notes. So, this is your 4 major types of HAI, and if you're aware, this comes up as a short note very frequently. So, how have I written this down? I have converted the subheadings into the table columns or the rows. So, definition, epidemiology, risk factor, what are the main organisms which cause this, what is the pathogenesis, what is the lab diagnosis, all of this which is specific for a specific type of HAI, I have written down. And just a page prior to this, all the common points to HAI, I had already discussed it. So no matter what the question asks me, I already have somewhat of an idea as to what to write. Right? In this one page, you will see that Klebsiella is common across almost all of these. You will see S. aureus is common amongst the last 3. Correct? So this is how I used to study. This is how I used to make my notes very compact. This was one example, and this is the entire chapter in one table. Now moving on to filariasis. So I'll explain the notes. So I start with the name of the disease. Like, okay, this is caused by a nematode. Then Malabar leg, which is like another name for this disease. Let's say the question asks me to explain Malabar leg. I know filariasis, but I don't know what Malabar leg is. So even if I study, there's no point, right? Because I'm not getting marks for that. So that's the other name. Then I've written the agents. There are 3 types. I've written that down. I've written the host. I've written the vector. Then we move on to the life cycle and the pathogenesis. And in this pathogenesis itself is the clinical manifestation explained. Like, why is anything happening? And in the clinical features, I've written the phases of illness. Like, first this will happen, then this will happen, the lab diagnosis. So in lab diagnosis, I've written the specimen. What is the specimen? When do you collect it? How do you collect it? Right? Then we have all these different tests. And in all these different tests, I have not only written what are we doing, I have also written what is the finding. Like, if you were to take the thick and thin smear, you will find the organism. Like, for example, in radiology, if you do the USG, you need to write what will you find in that USG. So I will find filarial dance sign positive. Correct? And at the very last, I have like the treatment because it was given in the book. Now, this is an alternate disease by the same agent. Again, I've written it in very short. Moving on to the differences. So earlier we have discussed that there are 3 different agents causing this similar disease. What is the difference between these 3 agents? I have written here in short. Like, what is specific to Brugia? What is specific to Brugia in terms of tests? What is the difference between all these things? What is the difference in their periodicity? So no matter which question they're asking me, whether they're asking me Brugia, whether they're asking me Bancrofti, whether they're asking me anything, I will write this basic down, the lab diagnosis, and I will also add these specific tests. So I do not need to learn 4 different pages for these 3 different organisms. I need to learn 2 pages. One with this generic everything that needs to be there, and second with the specific tests. Moving on to answer writing. Micro is very specific in the way it rewards you marks for writing your answers. So it has to be neat and clean. Obviously, your presentation matters. You would know that by now. You'll write down the organism, its classification. What is it? Is it a nematode? Is it a gram-positive bacteria? What are the disease that it causes? Life cycle, infective form, agent, host, vector, all of this has to be followed in a series. Then you'll write the pathogenesis of the disease with its clinical feature and the lab diagnosis. Lab diagnosis needs to be on a bullet point heading, subheading, specific finding basis. Don't just write, we will do this thing. Write, we will do this test in which specific finding, whatever the specific finding is present. This is how you lose marks. You just write, okay, we'll do ELISA. What will you find in ELISA? You'll find a specific antigen positive. Write the name of that specific antigen and tell them this will be positive in ELISA. This is how you write the answers and get good marks. And if the treatment is asked or if it is mentioned in the book, you may add it, but it's not a necessity. The boxes in Apurva Shastri are very high yield. They are gold. Again, you don't need to refer any other book like you did in first year. Just refer to one book throughout your year. You'll be fine. Learn the prototype lab diagnosis. For almost all the trematode, the lab diagnosis is very similar to each other with maybe one or two different specific tests. So you learn the generic prototype lab diagnosis before you try to learn the specific one. And invest in general micro, so that like the next time you hear culture media, name of a specific culture media, you know what is going on, so that you're familiar with the terminologies which will inevitably come up later in the systemic part. So that is it. I hope it helps you, and I wish you best of luck.